All right. It's good to know that this time is working for everyone. I assume it works because you're here. So that's great to know. As we look towards 2021, well, that's good feedback for us. So well, welcome. Thank you for joining us. We'll get started. I know some others may join us a little bit later on Miami time, which we're great with. But my name is Cierra Bragan, and I'm the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource, and we host events for moms and families. We have a website with resources, as well as we're on all the social media platforms and constantly looking for ways to encourage, equip, and empower moms. And so we have linked arms with UHealth Jackson Children's Care to bring you this amazing webinar series. When they asked us to join, we were like, absolutely, because we knew that these resources were so timely, especially, when we started back in the summer. And COVID was kind of in full force, and we were all just still navigating. And then now here we are still navigating. This has really been such a great space to get information that is trusted and from the medical experts themselves. So we are super excited for tonight. We're going to be talking about the topic of holiday safety. So we just kind of got through Thanksgiving, and we're seeing, on the news, the effects of that and different things. And so going into our Christmas season, we want to do so with wisdom. And so we've got lots of questions tonight for our experts. I want to take a minute to introduce those two to you. If you've joined us before, you are probably familiar with Dr. Audrey Ofir and Dr. Brandon Chatani. I believe they might have even been our very first webinar. So it's kind of fun that you're the bookends of this series for this year, because probably a lot of the information we covered in the beginning has evolved and changed. And so we'll speak more to that tonight. But thank you for joining us. For those of you who don't know, Dr. Ofir is the Associate Professor of Pediatrics and the Director of the Pediatric Comprehensive Care Clinic at Holtz Children's Hospital at UHealth Jackson Children's Care. So she is working with the little ones all the time, has so much wisdom to share. And most of her patients actually are medically complex children. So those with cerebral palsy, Down syndrome, autism, sickle cell disease, leukemia, and others. So I know she's got a lot of expertise to share with us tonight. So Dr. Ofir, we're so glad you're back with us for maybe the third or fourth time, but we're excited.
Thank you for having me.
Thanks for being here. And then, of course, Dr. Brandon Chatani, he's an assistant professor in the Department of Pediatrics in the Division of Pediatric Infectious Diseases. So super relevant for the topic that we're talking about tonight. He's also a principal investigator on grant-sponsored research. So he is a published researcher, so he's focused specifically on bacterial and viral infections. So I know he has got so much wisdom to share with us. If you've heard him before, you're really going to enjoy learning from him. And he's just a leader in our community as well. And so we're just so thankful that you are with us tonight. Again, Dr. Chatani, thanks for joining us.
Thank you for having me.
Well, I want to dive right in. I do want to tell our audience, if you're listening, I hope you're listening, but make plans. We're going to do our very best to stay kind of right around an hour. But at the very end, you don't want to miss it. So stay with us till the end, because Kim from Nailed It DIY in Miami is going to be sharing a DIY tutorial with us, and she's going to be offering a special giveaway. So you want to hang with us the whole time so that you can see that at the end. But we'll get to that in just a minute. But let's dive right in terms of this topic for holiday safety and COVID. So let's start here. Can you, Dr. Chatani, tell us, what do we currently know about COVID and COVID precautions, and how has this changed from what we thought we knew, even when we first met with you back in June?
Yes, there's been a great deal of change from day to day to each month that we've been able to keep up with. And as the CDC releases these new updates, they give it on their website, so you can always check to see what the most up-to-date recommendations are. I think the most interesting update in terms of precautions is that previously we always spoke about 14 days of isolation is what was necessary to keep everybody safe. But most recently, meaning this month, the CDC released and shortened that period where you don't have 14 days. Actually, it's first was reduced down to 10 days, and then now more and more of the literature is supporting down to 7 days of isolation.
Oh, wow. So like cut in half, literally, since what we first knew.
Yeah. And to let everybody know that that's based on studies that look at not just the PCR. So what we've all come to know and love is that lovely thing that gets jammed up your nose and you tell whether or not you have COVID, right? But that's
Right.
looking at just the DNA piece, a dead piece of the virus, and can't really tell you if you have an active viral infection. So what the
Wow.
CDC did and a bunch of researchers got together to do is to look at, okay, I test the virus in you. Is it working and causing infection? Is it infectious or is it not? And what they found was that 7 to 10 days after you first were found positive, it's no longer infectious. It no longer can
Oh,
cause
wow.
infection there after the 10-day mark. Now that's different for different people. And I have
Right.
to make a remark about immunocompromised patients, whose immune system isn't so good with fighting infections.
Mhm.
Those people, it's going to be outwards of 20 days still. And that number hasn't changed from the beginning.
Okay. Okay. Yeah, that's really interesting. And even just having this conversation now, because when we had this conversation back in June, there just hadn't been a lot of time for that research to happen. And now, you are a professional in this specific category of infectious diseases. So it's neat that you're like, can share the research with us because we hear a lot on the news and it's just hard to know what to take in. And so I'm so thankful for the space because we get to hear straight from both of you. So I'm thankful. Can you tell us, are the main transmitters of COVID still believed to be surfaces and airborne particles, or has that changed?
No, that's the same. That's
Okay.
Yeah,
Okay.
it's still going to be that contact, being in a room, close confinement without a mask with
Yeah.
someone who's infectious. 15 minutes is really all it takes.
Wow. 15 minutes. Okay. I didn't realize that. Tell us, what's the status again? We hear things on the news, but what's the status of a COVID-19 vaccine? And should our family get it as soon as it comes out, or should we wait for a little while and kind of see how things go? Like, what would you suggest?
So the vaccine's going to be only available to very certain populations in the very beginning. So don't be dismayed if you see that you don't qualify in the very beginning.
Okay. Okay.
Also, it's going to be a personal choice of whether or not you take the vaccine or not.
Mm-hmm.
And you have to look at the research and understand or have that discussion with your medical provider of the risk versus benefit for you, or specifically you.
Right.
For the large majority of healthy adults, it's going to be fine. The side effects are what we normally see with any other immunization, some soreness, fatigue that's there. You may not feel tip top 100%, but that's surely better than getting COVID.
Right.
As far as children are concerned, it's not going to be available right away. There's still lots of studies that need to be done, and getting those numbers shored up so that we know and feel confident that it's safe for kids to get as well.
Okay. As a mom, I'll say like that makes my heart a little bit at rest to hear. I'm like, okay, let's make sure we really, really, really know for the children. And we actually have a question that came from our audience, along this line, that her daughter has coming back from college soon and she's actually already had COVID. So she's thinking, oh my goodness, now my daughter's going to want to like go out and do things and be around because she's like, I've already had it. But like in their house, the mom, the dad, the younger children, like they haven't had it. So what is your thoughts, your advice on that? And then if you've already had COVID, do you need or should you get the vaccine? Or if you've already had it, are you kind of like exempt, I guess? Two
Well, you
questions.
have to get tested. For the latter part of that question is easier to answer. If
Okay.
you've already had COVID, um, you may or may not develop antibodies. So you'd have to get tested to see if you have antibodies, and whether or not that might offer you some protection. As
Okay.
far as whether or not you have antibodies, though, its protection is for you. You still can get COVID, even if you had it before.
Okay.
You can get it and spread it to other people. So it doesn't completely protect the situation. You can't go out and party, even if you've had COVID once before. You still have to follow those precautionary measures to make sure you don't spread it to other people.
Okay. That's good to know because I'll be honest, I kind of thought it was like chicken pox, that like, got it, I'm done, like I'm fine. So that's an interesting thing to know. Okay, great advice. Another audience member is asking, are there various COVID? I've heard that there are, like COVID-19 is the one that we're talking about, right? Like COVID is a particular disease that there's different strands of. Is that the case?
Yes, there are multiple strains that are out there. And we know that it's been, or as far as we've been able to tell, it's been linked to certain parts of the coast of the US. So there's a European strain and an Asian strain that have been described. Some of them are more likely to cause the condition we've talked about before, MISC. Others are more serious in the disease that they cause in the acute disease, in the very sudden disease when you have COVID. On this coast, we more have the European strain, which geographically makes sense. And then on the other coast of the US, they have more of the Asian strain there.
Interesting. Interesting. Okay. Wow. I'm learning so much. Audience, aren't you learning so much already? I'm like, we just got started. Okay. Let's dive into talk about the holidays. How can we safely celebrate the holidays this year?
Well, I'll take that one if you don't mind. I
Awesome.
think that I'm definitely getting from my patients and their families that they're really struggling, especially recently with the number of new cases of COVID-19 in Florida and in particular Miami. With those numbers rising, they're having really a lot of struggle trying to balance off maintaining their traditions with celebration and trying to keep their family and their loved ones healthy and safe. And as we've discussed in previous webinars, and I'm sure we're going to go into more detail later on, there is a range of risk for the COVID-19 transmission of the virus and certain parameters that we look at. So we can make those gatherings the safest, which is very frankly the virtual one. So you have absolutely no face-to-face contact, no interaction. You're with your household members and just virtually looking at and sharing the celebration virtually with your loved ones. And that's really the safest way. And then on the completely opposite extreme, you have the riskiest type of gathering, which would be a very large gathering, indoor with many people. In a small place where safe distancing would not be allowed, maybe with some of the guests coming from out of states, some people not respecting not only safe distancing, but not wearing their mask. And that would be the complete nightmare scenario. And I'm hoping that nobody is going to think of hosting a gathering like this.
Okay. Yeah. So should gatherings be limited in a certain number of people, and should everyone quarantine before or get tested before gathering? What would you suggest about that?
Those are great questions because I think that people are trying to find what is that magic number, or, that will make it safer. And before answering that question, I think that the first thing we need to know is it an indoor versus an outdoor gathering? Because we all know that outdoor gathering is definitely safer. So if the outdoor gathering is not possible, and if you're going to make it an indoor gathering, then it's not really a matter of a magic number. It really depending on the inside of your living room or your dining room, what is the maximum number of people it will allow you to have and respect that safe distancing. So depending on that, that is your magic number, very frankly. And then regarding the quarantining, if you want to keep the others safe, before the gathering, it would be a good idea for you to stay home and quarantine. And hopefully your guests as well will do the same. As far as testing, it is very optional because as we all know, the validity of that test is only good for that day. So it provides a little bit of a sense of security. I know that some people feel more comfortable with it, but it's really just optional.
Okay. Yeah, that makes sense because you could take the test and then drive in your car and walk in Publix, get sneezed on, and then you got it.
Right after the test, you can have extra exposure, and then it's really a moot point.
Okay, great. Now, what about should gatherings be limited to a certain amount of time? And what are the current guidelines for how long two people can be near each other before the likelihood of contracting COVID increases? I feel like you said something about 15 minutes. Is that?
Right. Yeah. The CDC defines close contact as 15 minutes when you've breached that 6 feet barrier. Once you're closer to someone than 6 feet for 15 minutes, that's considered a high risk situation.
A high risk. Okay. So 15 minutes closer than 6 feet. It's good to know. I hadn't heard that. So what about, is there a place for indoor gathering in this year's holiday season, or should everything just happen outside? I know you spoke to like your size of your living room and kind of finding your magic number, but obviously it's probably best to just be outside. But is there a place for indoor gathering at all this year, you think?
Well, I think that in Florida, we're blessed with an amazing weather and really warm temperatures. So if at all possible, try to make it an outdoor gathering. So whether an outdoor patio or a backyard, it is always safer to make it an outdoor event. But if not possible, then there are certain things that you can do on the inside of your house to be able to make it a little bit safer. So you want to go ahead, arrange your furniture and the chairs on the dining room table, for example, to have a safe distancing between your household members and your guests to be able to make it safer, because obviously during the dinner, you're not going to have your mask on. Try to ask your guests to be able to have their mask on when there's no eating. Make sure to remind them to sanitize their hands as well.
Yeah. Okay, that's good. Any other general steps that we should take in anticipation of a holiday celebration? I like the, positioning the furniture and setting it up for things, but anything else you would recommend?
Well, I think there's two main things. One is, I think, trying to make sure in anticipating first the invitation, I guess, and the gathering itself. I think that a lot of families are struggling with perhaps a little bit of pressure from their loved ones regarding the gathering. I think it's important that they feel comfortable with the decision. I think this is a year where we have to prioritize the safety and the health of our family and our loved ones. And it is important to be able to feel comfortable with our decision. Remain healthy, and eating healthy and getting our sleep and exercising is important. But then on the other hand, if you are going to have a gathering, then there are a couple of steps that you can take in order to minimize the risk. So make sure that you're going to have the right amount, again, that we mentioned, the right amount of individuals that is going to allow you to have safe distancing in your house. You want to go ahead and make sure that the guests will sanitize when they come in. You want to have extra masks in case they forget theirs. You want to go ahead and have, again, like I mentioned, the chairs at safe distancing between your household members and them when they're going to be eating. You want to assign one person to actually serve the food. You don't want to have the food platter going around like we usually do during the dinner, because that's a higher risk. You want that person to be washing their hands before and after, or wear gloves during the serving. Same thing with the drink. Probably it would be preferable to have an individualized drink bottle in front of the guest. And then by the same token, you probably want to assign one or maybe maximum two people going into the kitchen, either to get the food or to be able to get the plates out into the kitchen later on to be able to clean up. And that is just to minimize the traffic in and out of the kitchen. Sanitize the surfaces, very important, of course, and then putting the mask back on when the dinner is off. And another time factor would be, if you remember, there are obviously the different factors that we mentioned as far as safe distancing and the mask and the sanitizing, number of people. But there's one extra factor that we talked about in our previous webinar, which is the length of time of the activity. So maybe if you're going to invite your guests, you might want to say, well, we're thinking maybe between 6 and 9 or something like that, and not let it be a whole night event kind of thing.
That's good. That's
Something
good.
that I would add is also like thinking about bathroom use.
Right.
Is everyone going to be using the same bathroom? If you have the availability to use more than one bathroom, then kind of splitting and assigning who can go where.
That's good. Or I'm just going to put a little caddy in the bathroom and I'm going to have everybody clean it every time they're done. And I hope my children will learn this holiday season. You guys are onto something. Dr. Chatani is onto something with that. I'm teasing. No, great tips and things that we just don't naturally think of, because this is not a norm for us. We're still adjusting all these months in. We've never done COVID Christmas. So we've got to know ways that we can be prepared. So even the food thing, I hadn't really thought about that. I'm like, we set it up as a buffet and everybody goes and they dips, but everybody touches every spoon and everything. And so that's just a lot of, cross contamination of those germs if we're not all clean. And yeah. Okay. Interesting. All right, let's keep going. I have a few more questions. Okay. If children are going to be present, should their exposure to one another be limited? Because when my kids are with the cousins, it's like dog pile in the living room. So what should we do with the children?
Yeah, children is very tricky. I think that just because by the fact that children cannot be really controlled a lot, and then the fact that less than 2 years old, you cannot put a mask on them. I think this year particularly, we have to think small. So you don't want to have a lot of children at the gathering, very frankly. But if you do have a few children, then I think it is important, first of all, before the gathering, to talk to them, to remind them about safety, social distancing, wearing their mask. You want to go ahead and bring your sanitizer and wash their hands a lot, or sanitize their hands a lot during the gathering. And then you probably do want to think of activities to be able to keep them busy, but safe activities. So no sharing of toys or objects, and then distancing during the activity. So some kind of artwork or something like that, not playing with a ball together because that's not going to work out. So you want to try to think ahead of some kind of activities to keep them busy, but safe.
Yeah, it's going to be tough. And I think that the highest risk group is going to be that 5 to 9-year-olds. Older than 9, you should be able to talk to your kid and have them wear a mask and follow those rules and do everything. But older than 5, studies show they are more likely to give everybody else COVID. As compared to younger than 5, they're not so much high transmitters.
Okay, I didn't realize that.
Yes, but they are great receivers. So equally, as a parent, making that consideration that any adult in that space could give your child COVID, and it can be serious. So that's a key consideration families need to talk about.
That's good. That's good. I think can easily be a misconception, is that, children are exempt, so we're fine, but it's not the case. And we're hearing this from pediatric professors and medical professionals. So it's a good thing to be reminded. Thank you both for that. Okay, tell us, who should not be in attendance at this year's holiday gatherings? Is there any, certain group of people or that should not attend a holiday gathering?
Yeah, I think we can probably categorize them in 4 main groups. So there's first the ones who are COVID positive. That's an obvious one. If someone tested positive, obviously they should not attend any event or gathering.
You're uninvited this year. On the naughty list. Sorry.
The second one is somebody who is symptomatic with some of the symptoms of COVID-19. Maybe they are awaiting their test results. Anybody symptomatic really should not be in a gathering or even at any event. The third one is anybody who has been exposed or in contact with anybody who is COVID-19 should be quarantining, what we say, and therefore should not be during that period where they could be developing symptoms and maybe don't have it yet, really should not be attending any gathering or event because they could be putting other people at risk. And then the fourth and last group, I would call it probably the medically fragile, if you will. Those are the individuals who have a condition that puts them at a higher risk for complications, if you will, if they do get the COVID-19. So that includes the elderly, the pregnant women, the people with cancer or leukemia, transplant, people with chronic diseases, chronic kidney disease, a sickle cell disease, any of those certainly would be at a higher risk. So anybody from those 4 categories, I would think stay safe, do not participate in any gathering.
Okay. Great. Yeah. That's good. That's good. All right. Yeah, it's serious. So talk to us about travel. Travel is always something that happens around the holidays, but do you have any tips? Should we avoid planes and drive instead? Should we avoid travel altogether? What are your tips for traveling during the holidays?
The travel industry has changed dramatically since COVID has started, and their policies and procedures have changed every day. So it's important with whichever mode of travel you're choosing, you review what their policies and practices are. You know, make sure that your airline, the airline, if you're choosing an airline, is respecting not selling the middle aisle, the middle seat. So you can have some distance between you and the person that you're sitting next to. But flying still carries the highest risk of any of the modes of travel. Having a personal car and driving with your family is going to be safer as long as you're safe with the stops along your way to your final destination. So those are some considerations. Of course, wearing a mask and hand sanitizer are going to be key in keeping you safe throughout your travels. And yeah, it's a tough consideration if you have to go a far distance.
Sorry, I thought I had a visitor, a little child sneaking in. Sometimes I have a child who sneaks out of bed and into our webinar, but it was not a child, so we're good. Okay, so let's talk about travel. If we do choose to travel, should we allow for extra time between arrival and gathering for things like a test or a quarantine?
For extra time, you mean like to?
Yeah, like if we're going to visit family in Mississippi or wherever, should I arrive a couple days early to kind of take a test or quarantine myself before we go straight into our family gatherings?
The issue is that yes, the test tells you about what your status is at that moment, but there's the incubation period that you have to consider.
Right.
That's the time period that a virus needs to kind of build up itself inside of someone's body. The test is good, but the test is good for when that level of virus has been reached. And that doesn't happen right away. It would take 3 to 5 days. So let's say you travel, you get exposed. Are you going to wait around for 3 to 5 days before getting tested and then getting a result and then being able to commingle? It kind of gets complicated at that point.
Yeah, everyone's going to be taking extra vacation at Christmas. I need extra vacation to be on. I'm teasing. But yeah, you're right. Okay, so you got to take that into consideration. Dr. Ofir, you want to add something?
Well, I mean, I think that I know that families, it's a big dilemma because the issue is when those loved ones come in town during that quarantine period, where do they stay? That's the other thing, I mean, because if they're going to stay in an Airbnb or in a hotel, well, that's a risk in itself, so that's an issue. But I just saw that, I think it was today, that the CDC is now veering towards minimizing or limiting the quarantine to instead of 14 days, 10 days, and they're going to look out to decreasing it to 7 days actually. So if that's the case, maybe it's a little bit less of a headache of logistic. But you have to think in terms of safety. And if you want to be safe, then yes, I would say if you have a loved one coming in, then probably you want to allow 7 to 10 days to be able to have this lag time before the gathering to make sure that the person does not develop any symptoms. Because just as Dr. Chatani mentioned, it is really usually takes the majority of the individuals, it takes 5 to 7 days for them to develop the symptoms. So
after they've been exposed. Yeah, interesting.
Correct.
Oh, that's good. Yeah, because you think, I mean, my next question for you all, which you've just answered it and sharing that, but it's like, okay, if I take a COVID test before traveling to see my family, is that enough to ensure we're safe? But what I'm hearing is I could take a test tomorrow, and at that moment, I have a negative test, but then on our way driving the day before, I'm at the McDonald's using the restroom or getting something to drink, and I'm exposed, but it's going to take me 3 to 5 to 7 days for that to show up. So I will get a negative test, but I'm still 3 days into our family gathering. Now I'm exposing it to everyone at our gathering. Correct?
Exactly.
Right.
make it even more complicated, if your test is negative the day of departure, but you were exposed the day before your departure, it will take a couple of days until that test actually comes out positive.
Wow.
So even if you have no exposure, once you arrive, there's still that window period. So it's quite complicated, actually. And that's why we always say that the validity of the test is only that day.
Yeah. Okay. Wow.
So
Yeah, I
planning
think there's
it
a lot
out,
of
I mean,
misunderstanding around that. That's good. Sorry, Dr. Chatani, go ahead. I'm sorry.
no, planning it out, I mean, you might plan out if you're quarantined and safe from exposure for those 3 to 5 days before you get tested. Then you get tested, you know you weren't exposed in those 3 to 5 days prior to the test, so that's
Right.
accounted for. And then if that test is negative, you know the time period before that you weren't exposed and you haven't developed the level of virus needed for a positive test. Then you
Right.
have some reassurance of, okay, on this day, I am negative and I've been practicing safely so that I can move forward with whatever plans I have thereafter.
And then you just hope everyone that you gather with has done the exact same thing, which is where it gets very complicated. I see. Just all that I'm hearing about, even the contact tracing, I'm like, it's unbelievable because there's, like you said, there's just so many variables to when you're exposed and when you're, yeah, transmitting, I guess. Okay, shifting gears a little bit, we received a question from an audience member, and I also just want to know, what about gift giving? You know, we talk about distance and touching and surfaces. Do I need to wipe down all my presents before I open it? Like, should I open it with gloves? What should I do?
An interesting question, but I guess there's two layers of risk to that. There is, just as you mentioned, the actual package, and the risk is pretty much the same whether you're going to have it delivered by your mailman or the Amazon delivery or a person. You still have the risk of the package itself, but the extra layer of risk is there if you have an exchange of actually face-to-face interaction, because you don't know whether the other person is carrying the virus. And so if you're doing that gift exchange face-to-face, it carries with it more risk than just the box.
Yeah.
Right.
Everybody just needs to send virtual gift cards this year. Gift cards are great ideas.
You can
I
give
think
a
that's
gift.
ideal. In the gradient of things that we started with between the virtual celebration and the large gathering, I think that the virtual gift card is pretty much the safest. You're right.
It is
Perfect.
if you want to give a gift or receive a gift for that matter from a family member, remember that COVID-19 only lives on surfaces for a maximum of 72 hours. So I know
Okay.
a lot of stuff out there about how long it lives on what kind of surface and where. The general rule is if you have something in your household that's separated, nobody's touching it, nobody's exposing themselves to it for 3 days. After that 3 days, you can open the gift. So it might be a good idea, start receiving those gifts early, having those exchanges earlier, putting those gifts aside for kids so that they can open on Christmas Day and it's safe for them to open them.
That's great. If you don't have toddlers, they're safe under your tree. If you have toddlers, they're unsafe for a whole other reason, but touching is not even the issue. That's great. Wow, thank you so much for all of this great wisdom. I want to say, if those of you who are listening, this is tracking more questions for you, feel free to drop those in that Q&A box. And what we're going to do is we're going to take a pause and transition to our time with Kim, but we'll circle back to that Q&A box. And if we have a couple questions at the end with some time, we'll be sure to cover those. But so many great tips. And Santa, if you're listening, I'm a size Starbucks gift card this year, so you can just send me that and I'll be happy. You can send those via email. No, I love it. It's these challenging times call us to get creative, and so we can respond with frustration and anxiety and a number of other things, or we can say, okay, how can we get creative and while staying safe and caring for our loved ones, as well as, taking care of ourselves. So thank you for giving us great feedback and ways to do that. Dr. Chatani, Dr. Ofir, we're very grateful to have you here tonight. So let's take a pause. And I want to transition, introduce you to Kim and her amazing daughter. They are a family-owned business right here in Miami. It's called Nailed It DIY. And I can personally speak about this business because Miami Mom Collective has been there. We hosted an event with them, and their studio is amazing. And they're actually still doing some in-studio projects and gatherings in a safe way. So if you're looking for a little family outing, or a date with your significant other, or even your child, or a small mom's night out, it is a great place to just get away. And I always say that art is like therapy, because you can just kind of turn off. And the good thing is, if you're not very creative or artistic, that's okay, because Kim and her amazing team are going to walk you through everything, and you're going to go home with a beautiful project that you feel proud about. And so I can speak firsthand that I made a project there, and I don't usually feel proud about my projects, but Kim helped me out. So Kim, we're so glad that you're with us tonight, and she is going to lead this next little segment on just a special DIY project that you can do at home to amp up your gift wrapping. So we talked about we can still give gifts in a safe way. And I know some of you moms out there love to make your gifts beautiful, and Kim's going to show us an easy way to do that. So Kim, thanks for joining us tonight, and take it away.
Well, thank you so much, Cierra. You nailed it, literally, on the description of our studio and what we do here. You explained it perfectly, I'll tell you.
Took the words right out of our mouth.
Yeah, exactly.
Love what you're doing. You guys are doing such great work.
Thank you. You know, in this time, we have to pivot, and it's brought out a lot of other things besides just big gatherings in the studio with, a lot of people. So we've kind of scaled down a little. We are still holding kids workshops. So what we're doing today is actually one of the things that we did with the kids in the camp. They loved it. They would come back in their free time. They would say, "Can we make another one of those? Can we make?" Boys and girls, they all loved it. And so then we decided that it would be super cute to use these to decorate your gift packages. I don't know about you guys, but this is my youngest daughter. She's 17 years old. But growing up, raising my kids, I love to craft with them. Like, to give a present, what can we make? It wasn't always just go to the store and buy something. Let's make something. It's a little bit more special that way. So these are kind of like what we're doing today, but this is what the kids did in camp, and they did, and they painted the beads, and this was a bookmark. So we called this a bookmark, and we made this out of yarn and beads, and they painted. So we wanted to do a version of that, I guess, so that you could use it to, like we said, decorate your packages. So basically, and I know everybody nowadays has seen pom-poms and beads, and it's like all the rage everywhere. And they even have on Amazon a pom-pom maker, but when you can do this without buying a $10 contraption, let's make it.
Are the pom-pom makers, right?
Yes, yes. So if you look it up on Pinterest, it'll tell you that you can just take the yarn and you can wrap it on your hand like this, and you're supposed to wrap it like 50 times, something like that, right? So then the problem with the kids, though, was that they had an issue with being able to tie it and cut it and get everything in the same spot. So we came up with, I just took like a piece of cardboard and I taped the first string down, and you tape that down, and then you take your yarn and you just kind of like hold it this way, and then you just wrap it like this. I know it kind of probably looks kind of weird right now, but can you see what I'm doing, Cierra?
So you're just wrapping it from the whole ball of yarn, and the other side is like you just put a little extra hanging off. Yeah. I'm craft challenged, so I'm going to ask questions. I want to make sure how to do this when you're gone.
So the kids, they found it much easier to do it this way, to keep it straight, if that makes sense. Once they get going, they're literally just wrapping. You see these little pieces are the edges that you're going to use to tie it off on. But when they're sitting down and they're just wrapping like this, they're just basically twirling it, and I have my ball of yarn here, and you're like count to 60. Well, sometimes it takes them, oh, did you lose? Okay, start over. And then they'll just keep doing it again. So this would be a great thing
It's like a
for
fidget spinner. Perfect.
a holiday get-togethers. Yeah, exactly. So here's one that's already done. So I have it all wrapped up. And then here's my 2 pieces on the side. You see these pieces that I have out? So you're gonna tie that together.
Just in a simple knot.
Yeah, so you just want to hold that up for me, Tay. So you just want to tie that in a knot so it gathers it together in the middle.
Awesome.
I need your finger. Thank you.
I need a tailor at home to help me.
Yes.
Make sure you recruit a tailor, everyone.
One more time.
One more time.
I think so. I got it.
My mom has always been the kind of person that says, I can do that myself. So this was all completely her idea. She referenced Pinterest earlier, but she just one day was like, I want to try this thing with the kids. I want to, because the kids, they can be here for a week for camp. And how much wood can you fit in your house is really the question. So we wanted to find some different ways to craft with them because we are a DIY studio, which doesn't always mean wood. A lot of the times it is wood, but you know, we like to mix it up here and there. Yeah. So this was just like a fun new way. And we thought if you go to your local craft store or even on Amazon online, you can find really cute yarn like this one we found at Michael's. I think it was on sale and it's different, you know, like Christmas colors. Yeah. So you can really match it with your tree. I know our tree isn't traditional red and green. Ours is rose gold and silver and pink. It's really popular this year. I think I've seen a few people do it. So you can even find the yarn that matches your wrapping paper, your tree, your house, your decorations.
Now you're gonna make me go look for sparkly yarn.
I know.
Good job.
And I think these could even be really cute to put on the, what's it called? The
stockings?
Your stocking holders.
Yeah, for them to decorate. Okay, so I tied this. I've tied it on this side, right?
Okay.
So then I'm gonna flip it over and you're just gonna cut the yarn in the middle, not with those scissors. I get the good scissors. And you're just gonna cut it like that. And then it comes off.
Oh.
And then.
Oh, there we go. Just fluff it up.
You fluff it. And then you can trim it. So like this one, I love, it's small. And I added a little bead to it.
I think also if you made a few tiny ones of the greens, you could stack them up and they could look like Christmas trees.
You could tie them together. You could add beads.
There's an endless of possibilities that you can do with this.
You know, for me, the kids, you know, we put out a bucket of yarn, different colored yarn, and just let them go at it and some beads. And they had a great time.
I love it.
And I'll give you a good tip on beads. So the beads that come by themselves are kind of expensive, but you can get the coupon at Michael's and you can buy the garland and then just cut it and you don't have to paint any beads.
As you can tell, we live in a craft store, as you can tell.
Yeah. So that's our fun thing to do.
By Michael. Perfect. I love it. Kim and Taylor, thank you. What a great way to elevate our gift wrapping and super cute ornaments too. I just think like if we want to have a meaningful homemade gift for grandparents, how great to teach our little ones. Cause I mean, the little one can do that.
Yep.
And then they can make a little ornament for grandparents or family. That's great. And it's easy. You just did it in 5 minutes. So we can do that. I love it. Well, Kim and Taylor, thank you so much. And again, I do just want to say, those of you listening, if you've never visited Nailed It, they're a little bit down south, but not far. Just jump on Highway 1 and drive. And then when you get there, you will not want to leave because it really is an amazing place. And it'd be a great place to make a good homemade gift for Christmas. So I would here in my office, I have my sign, but I can't reach it. I would show you everybody. But Kim is so graciously offering an amazing giveaway to someone in our audience just for attending. So just for attending tonight, you all were entered to win. And I'm super excited to announce that our winner of our special Nailed It DIY giveaway is Malgorzata. Salazar. Megan Salazar, are you there?
Hey.
Look what you've won. Okay, Kim, tell her what she's won.
Okay, so we talked about, you explained what we do in the studio. So in the very beginning of COVID, we decided to come up, well, we had to pivot in order to keep our business going. And so we came up with take and make kits. So I know we see a lot of that nowadays. So we put together little projects with all the materials, everything that you need to make the project in the comfort of your own home. So for the holidays, we have an ornament set. So it comes with a set of 4 wood slices, and then it comes with a stencil. So, and then the paints of you get to pick your paint color so it matches your tree, because that's super important.
And it comes
me,
with full instructions. So
full instructions.
And it comes with everything you need.
Everything you need.
Specially packaged. And it's very
So
simple.
easy.
Just like those cupcake or cookie kits that you got to take home and decorate yourself. It's kind of the same thing, but with wood and a cute wood project.
Kids of all ages can do it, for sure.
I love it. I can vouch for those take-home kits. I've done those, and they make it so easy because everything's right there. So if you're craft challenged, don't worry. But congratulations, Megan, and thanks so much, Kim and Taylor, for being with us tonight. Awesome. And I do want to make a little plug. We are having a Cookies with Santa event virtually, so totally safe, happening this Saturday at 6 p.m. live on Zoom. We've partnered with Jackson Health with the UHealth Jackson Urgent Care Center. And so Nailed It is going to have another little special surprise in our swag bags for that event. So they will be there with us. So if you want to come and join another fun Jackson event that we're hosting with them, we would love to have you join our Cookies with Santa event this Saturday at 6 p.m. So we'll share the link in the comments for that. But so much fun. Just thank you so much for being here. And I just want to wrap up again and say thank you to Dr. Ofir and Dr. Chatani. If there's any last minute questions, drop those quickly there. But I also want to tell you all, just thank you for joining us this year. I think it's been an amazing year. I know several of you have joined us for a number of these evenings, but we can't do what we do without just the amazing support of UHealth Jackson Children's Care, and just want to draw to your attention the amazing work that they're doing. The pediatric emergency rooms at Holtz Children's Hospital and Jackson North are open and available 24/7. So if you're ever in need of an ER, just know that the best of the best are there. So they're all staffed with board certified pediatric emergency medicine specialists, and you're going to get access to every sort of subspecialist in the pediatric realm if you're at Holtz Children's Hospital. So you're going to get it from the University of Miami Health System as well as Jackson Health. So you know that you are in good hands. And the Holtz actually has a 24-hour kids only emergency room. So hopefully this holiday season, no one needs the emergency room, but if you do, just encourage you to make, the best choice for your family. And at Holtz Children's, the doctors and the nurses are all certified in pediatric advanced life support. And so you just have amazing resources there at your fingertips. So thank you again just to Jackson Health and UHealth Jackson Children's Care for producing this amazing series for the last 7 months. We hope you've enjoyed it. We're so thankful that you've joined us, and we're going to continue in 2021. So stay tuned. We've got great new topics coming, and we just enjoy gathering together. So stay tuned. We hope everyone has an amazing holiday season. Again, Dr. Chatani, Dr. Ofir, thank you for joining us. And any resources that you ever need, those of you who are listening, you can find that on jacksonevents.org. You can watch all of the previous webinars there. So if we could ever serve you in any way, we're Miami Mom Collective on all the social channels, so just reach out to us. But otherwise, Merry Christmas, Happy Hanukkah, Happy Holidays, all the things. We're so glad that you all joined us tonight. So we hope everyone has a wonderful weekend and a safe holiday season.